This in-service animation has been prepared to assist you with the correct implantation technique of the Codman CereLink ICP sensor basic kit. This animation is not intended to replace the product inserts. Rather, it is to be used along with the product inserts as a training aid. Please refer to the product inserts and read the sections on contraindications, warnings, and cautions. The basic kit is designed for subdural and intraparenchymal pressure monitoring. Before getting started, you will need the following items to complete the procedure. 1. Cranial access kit. 2. The CereLink ICP monitor. 3. The CereLink power cable. 4. The CereLink ICP sensor extension cable that allows connection to the ICP sensor. 5. Codman CereLink ICP sensor basic kit. 1. Zeroing of the ICP sensor. The ICP sensor must be zeroed to atmospheric pressure prior to implantation. First, switch on the monitor. Connect the ICP extension cable to the yellow connector on the CereLink. The extension cable connector tab and arrows should face forward, in the same direction as the CereLink screen. Push the yellow connector into the yellow port until you hear a click. If you need to disconnect it at any time, this connection uses a pullback release mechanism and not a twist lock. Whilst maintaining a sterile technique, connect the ICP sensor to the ICP extension cable. Once the sensor is connected, the CereLink monitor will play a sound and will also display a 0 symbol. Press the Home tab on the CereLink monitor. Then press the 0 sensor tab on the CereLink monitor. Using sterile technique, lay at least a 5 cm section of the sensor horizontally just under the surface of the sterile water or sterile saline. Do not submerge the tip of the ICP sensor vertically in a deep pool of sterile water or sterile saline. Doing this will impose a hydrostatic pressure on the ICP sensor diaphragm that is higher than atmospheric pressure, resulting in an inaccurate 0 reference. Hold the sensor still without applying any external pressure to the tip apart from the sterile saline. If the device senses the sensor is moving, a 0 button will not be available. Press the Ready to Zero tab. You will note a 0 in progress on the screen. When sensor zeroing has been successful, the date and time will be displayed on the screen. During this zeroing process, the ICP monitor automatically stores the 0 reference value in a memory element embedded in the ICP sensor. This feature allows the user to reconnect the ICP sensor to the same or a different ICP monitor without having to readjust the 0 reference value. Press the Accept button on the lower right portion of the screen to return to the main screen. Now the ICP sensor is ready for implantation. 2. Preparation for sensor implantation. Codman's Cranial Access Kit includes all the necessary components to create the initial access hole for ICP monitoring. When making the initial access hole using an aseptic technique, begin by hair clipping, prepping, and draping the patient. Make the necessary incision and retract the scalp to expose the skull. Now select the 2.7 mm drill bit for subdural and intraparenchymal procedures. Place the bit into the chuck, then hold the drill handle in place and turn the chuck counterclockwise to tighten the bit. Next, loosen the drill depth guide with the appropriate hex wrench and carefully slide the drill guide towards the tip of the bit until the desired skull depth is reached. It is important to note that the drill guide will not stop the drill. It is designed only to provide the neurosurgeon with a marker for drilling depth. Finally, tighten the drill guide in place with a hex wrench and begin drilling. Open the dura with an appropriate needle or blade. 3. Sensor implantation. The ICP sensor basic kit includes a CereLink ICP sensor and a 14-gauge 2E needle with a stylet. Bevel the burr hole edge on the side where the ICP sensor will exit. This will facilitate removal of the ICP sensor. Use the 2E needle to tunnel under the scalp from the burr hole site to the desired ICP sensor exit site. Remove the 2E needle stylet and thread the ICP sensor from the tip of the needle until the appropriate length for placement exits from the hub. The inner edges of the 2E needle are sharp, so exercise caution while threading the ICP sensor through. Gently remove the needle and estimate the length of the ICP sensor from the tip to the first kink by using the centimeter markings. Once again, retract the burr hole site and fold back the ICP sensor completely at the desired bend site to leave a kink in it. Avoid touching the ICP sensor diaphragm. For subdural ICP monitoring, place the tip of the ICP sensor on the brain tissue under the dura, opposite the beveled burr hole. The kink must be placed at the bottom of the burr hole, so that the sensing element faces the cortex, as shown in the picture. To ensure accurate subdural ICP monitoring, the sensing element must be facing the cortex. Failure to position the sensing element facing the cortex may result in inaccurate ICP readings. To minimize movement artifacts of the bone flap, place the ICP sensor under the intact skull. For intraparenchymal ICP monitoring, place the tip of the ICP sensor into the parenchyma through the puncture in the dura until the kink is at the edge of the hole, as shown in the picture. Carefully pull back the excess ICP sensor tubing. Remove the retractor. Verify homeostasis in the insertion area, and then suture the incision site closed. For additional strain relief, make a small loop with the excess ICP sensor tubing and tie the loop down. Attach any off-the-shelf ECG electrode to the patient per ECG electrode's instructions for use. ECG electrodes should be applied only to intact, clean skin. For example, not over open wounds, lesions, infected or inflamed areas. Attach the patient lead of the extension cable connector to the ECG electrode. Secure the patient lead of the extension cable to prevent tension on the ECG electrode. Precaution: the patient lead of the extension cable must always be attached to the patient via an ECG electrode to ensure reliable performance of the sensor.